Here we have a review of a Bizanga 4000 FUE case, fairly large case, and that's been bolstered with 468 beard for this patient. This case has been quite popular on our YouTube channel. You can see 21,000 views there. So it's got interest, and thankfully the patient was able to progress it from prior surgery through to 12 months. We can be looking at that as well. What really hits me first of all is you can see patient's 30, so there's fairly advanced loss for a 30-year-old. The donor also, you can see some retrograde alopecia here, very fine temple points. Beard is a little bit coarser and darker. And when we look at body hair, I used to say to people, look at the 6 C's: the colour, the curl, the coarseness, the count, i.e. when it's body hair, will it be 1 or 2 hairs per follicular unit? Because generally you're going to get 1s and 2s, less than what the scalp would have. Look at the cycle, has it got a good anagen phase? How fast will it grow? And look at any contraindications. Normally, what I mean by that is any medication that can improve your scalp hair but limit your body hair. And that happened to me. I lost some leg hair on finasteride. My beard was still very good. So, breakdown of the graphs, 4,000 scalp. What hits me is that it's under 2 average. You can normally hit 2, 2.2, and maybe a little bit more than that if you're going back in the scalp because you select larger graphs. So to have 1.97, obviously the patient has got just a natively lower follicular unit makeup, large area as said, and we've marked out. You can see what happens here when you can see once you start thinning, the colour of the hair can lighten, it can become less glossy and finer, and you can see here he's got some retrograde alopecia which is in the nape and around the ear. So there's real challenges in the donor for a 30-year-old. You can see that on both sides, and a large area that ideally we want to place into to get back even past the mid-scalp point. 2-day surgery because it was a fairly large surgery, so at least how many singles did you get? 700 singles, which is going to say a lot of singles needed because of the circumference here. So that's a lot of singles gone, and this takes time to create on day 1, and then day 2. You really, if you do day 1, you could be quite discouraged, thinking, "Wow, all this day gone for this little bit of grafting." But as you get onto day 2, you can really see they've grafted way back now. Hairline normally high density, lower the density. Here's good density in the forelock, and you lower the density, spread it all the way back, and so it's a full 2 days. Extractions are well spread throughout. They need to be, and a little bit lighter over the years because of the challenges of retrograde alopecia. Beard obviously bleeding, a lot of vascularity around the beard, and also you've got the gravity pulling that blood straight down. So this is post-surgery and a good spread under the chin, so no real concern for scarring. And wow, 4 months already, the patient on this forum, you can see at 4 months a significant difference. To have any growth at 4 months is pretty good. This is very significant growth at 4 months, just gets better at 5. Already the guy looks very comfortable. You can see his pumping iron. Often what happens when patients have surgery and feel better about themselves, they hit the gym, they lose weight. You can see the veins here. Obviously got a weight training regime on, and this progresses through, just getting better and better. You can't see where the beard hair is, and 9 months continuing on. Donor was healed very well. Very, very short shaved step in the donor. Patient's comfortable enough with his shirt off now. It's obviously getting warmer and getting his biceps and triceps out, and here we can see a little bit dark on the photograph there, but you can see a very nice natural outcome, and the patient here at 12 months very, very natural looking with a comparison, very stark comparison. Seems to be that where we didn't place has improved also. It has been a good hit with the patients, and you know, the beard looks very coarse, doesn't it, compared to the scalp, but it has come in well, it's grown in very well, no concerns of it being compatible, and voila, there we have result at 12 months. Very nice change for this patient, and in fact he did say that he was very happy. It's really a team effort. Dr. Bizanga was the surgeon, but it's a team effort in terms of placing of the grafts and handling of the grafts, and then on the customer service it's really good to have that team effort, and that encourages the patient also, as this one did, to provide those photographs through to 12 months. And if you'd like to have an assessment, then please feel free to contact us. Above all, take care and thanks for watching.